Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited for our guest today. I've done so much in dentistry. Can't wait for y'all to meet him. Always a pleasure, and we're always grateful when we have a dentist on the program. Dr. Ravi Patel, say hello to everyone.
How you doing, everybody?
Hey, it's so, like I said, it's great to have you here. Thanks for your time. We appreciate it. I'm sure our audience will too. Let's jump right into the episode. Tell me, how did you become a dentist? What made you become a dentist?
Yeah, so, I was a biology major in undergrad. I always enjoyed working with my hands, and as a bio major, you have a few options. You're kind of limited on what kind of professional career you can do. Physician, optometrist, you can go into pharmacy or dentistry, and dentistry just sort of appealed to me. I had a couple decent mentors growing up as a kid. Dentists that I just went to myself that guided me along, pushed me along that path, and that's what led me to it. So I went to school at Southeastern University in Fort Lauderdale, Florida. I grew up in Indiana, so the weather was a lot nicer down there. Did that. My roommate in dental school, who's my best friend, actually ended up becoming my business partner here in Georgia, where we now both practice and manage our dental organization.
Okay, yeah. So let's talk about this. So first of all, how long have you been a dentist?
So I graduated in 2013, so that makes it 8-ish years.
Yep, 8-ish years. And now you've moved from just practicing to actually running a much bigger business than just a single practice. Kind of talk to me about that journey. How'd you get to, from your first practice to where you're at now?
Yeah, so it's a cool story. So my business partner, who's my best friend, right? We both ended up in Georgia. We had a healthy chunk of student loan debt. Nova's not cheap. No dental school really is. So you're looking, between $350,000 and $450,000 when you walk out. Yeah. We both ended up working for corporations, DSOs when we exited, and we quickly realized that this probably is not going to be the most efficient way to pay off our student debt. So we were looking for something, more to help, get us income to pay off our loans. So private practice became appealing. He bought his private practice first, and he bought the worst dental location you could possibly think of in the worst area of town. But we didn't know any better at the time, right? We were naive and young. So he ended up taking that location. We learned a lot from the mistakes that we had made with that single practice, and he grew it into a successful business. I bought mine shortly after he bought his and did the same thing. It wasn't exactly the best buy, but through trial and error, we learned a lot of things, and we grew that to become a successful practice. And then we just started acquiring offices on our own once we got the systems and operations in place. So we were practicing, 4.5-5 days a week at the beginning. And then we realized, this will generate income, but our bodies are going to fall apart if we don't change something. So we started, getting more efficient with our time, getting smarter with our time, and then eventually multiplying that by acquiring businesses and then managing those instead of just, being in the chair every single day, every single week.
Sure. So tell me, how many locations do you have now?
We're at 5 total.
5 total. Yeah. So you, some people would think 5 times the pain of one practice, but it can be very different than that, right?
Say that again. 5 times the pain.
It can be, like, some people would think, hey, if you've got one practice and it's hard, you're struggling, it's a lot of work. It's, you have to be an adult, right? You have to go through what business owners have to do. Some people think, hey, having 5 practices would be 5 times that pain, but it's actually the opposite of that, isn't it?
Yeah, I mean, it can be, right? Don't get me wrong. If you buy 5 businesses and you don't manage and operate them properly, well, it is 5 times the pain, right? It's 5 times the headache of everything involved with running a single operation. Before we jumped into, buying additional practices, we just looked at the industry, the main players that were out there. We had both worked for corporations prior to jumping into private practice. So they do things very, very well, whether we like it or not. They're really, really good at what they do. So we took the systems that they utilized and, created our own at the end of the day. And that's what's allowed us to scale is that.
Yeah, I agree with you. I think there's a big need for them, actually. They wouldn't exist if there wasn't a need for them, right? These big organizations. So I know you're out and about. You do a lot of CE. You're across the country. I know you just mentioned you were here in my town in Denver not too long ago. What are some of the biggest problems that you see dentists facing today? What is some of the common things that dentists who are just getting started are asking you about and talking to you about?
Yeah. So the biggest challenge I would say is staffing your offices. There's a staff shortage across the board. Front office is hard to find. Dental assistants are tough. Dental hygienists are unicorns at this point if you can get one in your office at a reasonable rate. So staffing is becoming the biggest challenge, and as a result of that, there's a lot of stress that's put on the business owner, which is typically the dentist. And then you combine that, and it leads to burnout really, really quickly. So that's probably the biggest concern that I hear.
Yeah. So what's the solution to it, right? And by the way, I want to say I hear the same thing, right? I hear it all the time. I know a lot of people are saying it's preventing growth of their practice, or it's making, they're having to turn away patients, or, so many different issues. What are some of the truths and the myths to why there's staffing issues? What are some of the myths that are out there? And then what are some of the truths that's going on today?
Yeah. So, I mean, staffing issues is no question. It's real. It's there. It's how we choose to deal with it that makes the difference, right? So, our organization actually grew during COVID, and then, post COVID, let's say. So, 2019, I'll just throw out some basic numbers. We were, doing about 4.5 million. During 2020, we did about the same. Even with the shutdowns and closures and all that stuff. And then 2021, we ended up growing by a couple million. So we ended up at 6.5 across the organization, with less staff, less time, less patience, and all that stuff. When we created this group, Depesh and I, my business partner, we, it was initially just for us. So we were working the crazy hours, the early mornings, late nights, weekends, all that stuff to get our businesses off the ground. We quickly realized that we can't do this forever. So we ended up creating these businesses that were just centered around keeping he and I happy. So our hours are standard hours, 8 to 5, Monday through Thursday. We work a couple Fridays a month, but they're half days. So 8 to 1 or 2 p.m. is really what we do. That allows the dentist to not burn out and keep practicing. And also it's good for your staff. They need time to handle whatever they need to. So, that's just one of the little things that we did to try and make work not so bad and make it bearable at the end of the day. You spend most of your time there, so you might as well have fun while you're at it. So the hours are reasonable. That helps a lot. As far as what we did to grow, we tried to replace the need for human beings as much as we could, and it sounds bad, but it's we still need these staff members, right? But how can we make their jobs easier so that they're not burning out and they're not leaving and they don't jump to the next practice for another dollar, because people are paying whatever they have to pay to keep their businesses moving. So from the operations standpoint, I'm the COO of our group. I'll just list out some simple things that we did, so every operatory has an isolator or dry shield in it. So that allows the doctor to work solo if they have to. It's not the most comfortable thing in the world to do, but when COVID hit, you definitely appreciated that. If staff members were not there, at least you could protect your paycheck to some degree. You could do some fillings, crowns, and your basic procedures to keep things moving along. Curing lights that are really efficient, that cure in a few seconds. We have those, 3-second, 4-second cures, and every operatory has one. So it makes it doable, if you're working solo, or if your assistant is there and they're working out of a couple of rooms, they're not sitting there curing for a minute at a time or whatever for a procedure. So we were literally just trying to shave seconds off of procedures that we do. From an operatory standpoint, hygiene became a concern. Hygienists were not available, and they still aren't today. We stuck in Cavitrons in every single operatory so that the doctor, while doing a filling, could also take care of the patient's cleaning. It's a win-win. Doctor gets to produce, patient gets their cleaning, gets some treatment done, and then the cycle just keeps going. We focus pretty heavily on same-day care. We try and at least make that an option for our patients, should they want to do it. So in order to make that happen, during the pandemic, the less interaction they had with multiple staff members, the better. the less movement that took place, the better. The less walking up to the front to figure out what that filling costs or whatever. We tried to keep every single aspect of the appointment within the operatory. So that included putting credit card swipers in every room. So point of sale payment took place inside the operatory. The filling was done. Patient leaves, they could run out of the door should they choose to. They don't have to stop anywhere and they can just exit. That requires a lot of work on the front end to make sure that the benefits are verified properly and all that stuff. But we started utilizing vendors outside the country, folks that will do these things at a reasonable cost and do them accurately and efficiently, which allows us to present treatment properly. And then everything just sort of trickles in right after that.
And so the dentist in your practice is presenting treatment. Is that correct?
Yeah, we'll do it because with the system that we run and the verification that takes place on the front end, whether the dentist says it costs $75 or the front office says it costs $75 or the DA says that it costs $75, if it's wrong, all of us are going to say it wrong. It's not going to make a difference. But if it's correct, which we try and do, of course, then everybody's going to be correct. So it really doesn't matter who says, what it costs.
Sure.
So that's why our dentists, nobody likes doing that at the beginning. It was uncomfortable. I didn't like doing it either. But after a while, it becomes just reading a number off the screen. This is what it is. If you'd like to get it done today, Mrs. Smith, we can make it happen, right now.
What about using technology? What type of technology have you utilized to help fill the gaps of absent employees?
Yeah, so we try and leverage tech as much as we can. We've got digital scanners in every single location. Some have multiple, 2 or 3. So if we can go digital on something, we always try to. I mean, we're in the process now trying to go paperless. So there's less stuff to scan, less people needed and required to do that kind of thing. Intraoral cameras are in every single op. We talked about the iSlice dry shields in every op, fast securing lights in every op. Anything that we can do to shave seconds off of treatment times we'll always utilize. The Cavitrons being in every single operatory instead of just the 2 or 3 hygiene ops. That makes a big difference. That means you can do any procedure in any room at any time. There are no dedicated ops any longer.
Yeah, makes sense. Let me ask you this question. We always like to give our audience something that they can do today, like what's, something that they can put into practice today. And right, some technology things that take some time, equipment kind of takes some time. What are a couple of things that you think they can do today? If they're listening on their way to work, what can they implement to help?
Yeah, I mean, one of the easiest things to do, and one of the biggest complaints that we have, I can't find a hygienist, right? And that's across the board. Doesn't matter what state you're in, you can't find hygiene. So one of the easiest things to do is go to your big box dental suppliers, Henry Schein, Patterson, Darby, Benco. They all have their in-house Cavitron, and it's a few $100s, not a few $1,000s. So you can pick these up for, relatively cheap. They come with warranties. Hook them up, get them in your operatory so that at least you're able to perform the preventative procedures inside the op. That will at least keep your practice going. If a hygienist calls out sick, you don't have one, whatever, you have one, whatever it may be. As long as you can get your patients through the door, and if there's a dentist there that's willing to do the cleaning, they'll be happy to see that patient for their recare visit. It gives them a chance to diagnose something. And if there's a filling or whatever that needs to be done, they can treatment plan that, get the patient to accept it. And between anesthesia and starting the procedure, there's time there, right? You can use that time to get the recare visit taken care of it as well. So, that dentist doesn't want to do recare because it's $100 appointment and, their time's way more valuable than that. But, if you got nothing else to do, that recare visit has got a lot of potential. There's treatment that's there that's undiagnosed or just needs to be completed. So it gives the dentist the opportunity to at least get it done.
Yeah, Dr. Patel, one of our listeners has an office and is thinking they want to go to 2 or 3 or 4. They want to start building an organization or align with an organization like yours. What are a couple of steps you think they should take?
Read as many books about business as you can prior to taking that leap. It's you can do it solo. A lot of folks have. It's really nice to have a team before you start, taking on that type of endeavor. For me, I got lucky. My best friend is my CEO. He's my business partner. And then we created a management team with our other friends because we couldn't afford to pay anybody when we first started. We were
Sure.
like, hey, if this works out, we'll eventually, see the financial gain. If it doesn't, we'll still be friends at the end of the day, But if you have to create your own team, you first have to know what responsibilities and tasks those team members are going to be responsible for so that you can hold them accountable. So again, most of that knowledge just came from reading. And there are tons and tons of dental books, business books available. You can just search top 50 business books to read. And I don't know, 40 of those are probably going to be really valuable.
Yeah, absolutely. I want to thank you so much for being here. I want to have you come back on the program. There's a couple other topics I'd love to have you to talk about here in the near future. But I want to encourage our audience to check out your website, blueprintsmiles.com. You've done a great job putting that together, by the way, and the way that you've built a hierarchy for what you're doing is fantastic. So, Dr. Patel, thank you so much for being here.
Thank you, Patrick.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.